My name is Akora Georgia William, the founder and executive director of Youth and Women Empowerment Foundation, a local NGO operating in Western Uganda. Our program is based on providing care and treatment for vulnerable people with chronic illness like HIV, and also we deal with other endemic diseases like malaria. So Yawe Foundation has been in existence since 2000, and we have reached out to communities to get health care. We are planning, or we have been implementing a project of community-based outreach to reach to rural areas and reach people who could not afford healthcare services, because most of the quality healthcare is concentrated in urban centers, and the government has health center tools which could not handle certain cases, and therefore it leaves most people vulnerable. So we want to look at neglected tropical diseases like leprosy, like onchocerciasis, and now there is a disease which is unheard of, like the pictures you can see, Podoconiosis. Podoconiosis is a disease which affects people as they interact with the loam soil when they are cultivating. So there are some areas in Western Uganda, that is Kamwenge and Kabarole district, and in specific sub-counties, you find people who suffer podoconiosis, which is a chronic illness. And these people, their livelihood is through cultivation. There's no way they can avoid interacting with soil. But when their skin gets infected, some of them end up getting permanent disability. They lose their livelihood, they cannot work on. But unfortunately, in all our programmings, in all our public health interventions at the district, even at national level, these people are forgotten. They live an isolated life, they suffer. Now, Yawe Foundation has a solution. We want to have a mobile clinic. Like you can see, in the past we used to hire a bus, which we had customized as a mobile clinic, and reach out to communities. You can see the line when we used to go to communities for the services. But unfortunately, that was way back in 2016, 2017, and when the funder who was giving us that funding ended, we couldn't reach people anymore. So in this project, our innovation is to acquire a mobile clinic bus. This project will acquire a bus, an ordinary bus, customize it into like a workspace inside. For we can have a laboratory, we can have medical officers, and then we offer services to grassroots people, especially those suffering from podoconiosis. And these patients, those who are very sick, we shall be transporting them to our static health center, which is located in the urban center, treat them, and the package for these people is we are going to care for their wounds so that they heal. Even if we are not going to correct their disability, we shall also give them protective wears so that when they are going to their field to cultivate, more people are not infected. They can use like gumboots. We shall also provide alternative source of income. For example, train them how they can maybe raise livestock so that they can earn a living, so that they don't need to go to the soil and get more infections. Some of them actually end up through those wounds, when they interact with the soil, get tetanus, and actually tetanus kills them. So we shall also provide the knowledge about hygiene, and also provide them hygiene supplies like soap. I know in these economic times our prices have gone high for soap, so most rural people have resorted to do without soap, and that compromises their hygiene and predisposes them to even other preventable diseases. So I am therefore requesting for this support Yawe Foundation, so that we can reach people who have been suffering to typically neglected tropical disease, and that is Podoconiosis.